Yeah. Dr. Wolf here. So we have Susie. We're going through our different instruments and some training, and this is the Medmont Meridia Pro. So it's a multi-modality instrument, so it's going to do corneal topography, dry eye testing, infrared imaging of the Meibomian glands. You can use off-label infrared imaging for really any part of the eye, but it's going to be listed as Meibomian gland imaging. And fluorescent, it uses a cobalt blue light, so for some fluorescent imaging. We may not go through each component of that, but we're going to go through several of it. Susie, one of my team members here, we're going to use her. A couple things just to get started. Always clean off the instrument. The instrument does have a calibration ball that needs to be calibrated. I don't know, I'd probably say like once a month if you are not really moving the instrument around, but sometimes these devices do get a little bit jostled unintentionally. And the calibration ball is actually, there's a compartment here that pulls out. The ball screws in through a little hole right here, and then we won't demonstrate that, but it's a good thing to do fairly regularly. Okay, on and off button is right here. Green means that the instrument is on. Yellow would mean the instrument is off. You don't need the instrument on to view the software. Okay, which I believe in the past, it's been a while since I had my E300, which was the predecessor to this. I think that you did, but with this one, the instrument itself, from as far as a camera and topographer perspective, can be off, and you can still function the Medmont Studio. So the other thing that I wanted to discuss is more of a tip is essentially, having clean hands. We do have some sanitizer here, but then if you're going to be manipulating the eyelids, another good use is just hypochlorous acid spray. Hypochlorous acid is used as a antimicrobial agent. Okay, so that's kind of a nice thing to use without any kind of irritation to the eye. All right, we're going to start over here. And so we've got our patient pulled up using some previous images. We're going to go to corneal topographer. Corneal topographer is not actually going to load just the corneal topography, but it's going to load topography, composite topography, where you can basically stitch multiple together for a wider view, video topography, tear film analysis, which is essentially kind of the same thing, but essentially it's using software from a tear film component, and then regular photos, which is just a kind of a wide field white light photo. Fluorescent, essentially the same thing. It's a wide field image, but with a cobalt blue light. And then Meibomian gland is just your infrared imaging. We always like to start over here in the Meibomian gland because it's gentle. There's no light. Infrared, of course, is invisible light. So we're going to start there. Takes a couple seconds for the camera to pull up. Like all other instruments, there's a little line here that you kind of adjust the patient up or down, so you feel like you're really comfortable there. And have you just kind of look straight ahead. And then you can see that you probably get about, I don't know, maybe 25, 30 millimeters. It's a pretty wide view in here. The yellow rectangle is your, it's basically your zoom area. So there's a button on the instrument. There's actually 5 buttons. There's a capture button, there's a zoom button, there's kind of a back and a forward button. These are nice tools to use. So when we zoom in, what we're seeing in the screen is the yellow rectangle. Okay, so that's nice to zoom in on certain features, particularly glands and eyelashes or any punctate staining. So there's a number of things you do here. We always kind of generally will like to just get a normal, relaxed, straight ahead photo. The patient doesn't even really know that the image was taken, and they can't see anything. From this type of image, it's going to populate them on the side. You can save them, delete them, or you can maximize the image. If you maximize the image, it's going to look just like it would in the review software component. This tells you your pupil size. You can measure the pupil, okay? Okay, just like that. Other features you can do from this is to your meniscus height. Okay. And you basically can see at the eyelid, there's these little white dots right here. That is where the tears are basically sitting against the eyelid margin. That's the anterior meniscus height. Generally grab one either near the center. So there's a couple here that I can pick from. I just grab it, click it, drag it down to the eyelid. Okay. There's another one to the side. I can do the same thing. I hit anterior meniscus height again. I can do another one, drag it down. Okay, you can take as many as you want, but it'll give you an average. Okay, when you look at your annotations, your meniscus height looks more or less pretty good here. Okay, other things you can do when you're looking at these views, especially since they don't perceive any light. Again, we talked about the pupil function, but also the eyelid position. So people that have ptosis, maybe dramatic chalasis, things like that, you can kind of see how their overall upper eyelid position is. Also, pinguecula is pretty easy to see over here. She doesn't have one, but for patients that do, you'll be able to see those pretty easily as well. All right, so I'll just swing over and do one for the other side. Same thing. Generally with these, you don't necessarily need to zoom in, but if you want to zoom in and then pick a particular feature on maybe the iris or one of these reflection points, you could use that to focus your camera and then just zoom back out, and then you just capture your image, and now you've got a pair of images there. Okay, you can save them over here above the images. There's what looks like an old floppy disk. You can save it that way. You can also, over here under home, it'll say save all. You can save all of your images. So we're going to save all, and then to get out of the setting, you need to close your capture screen. So at the top, it'll tell you where you're at. It tells you Medmont Meridia Meibomian gland capture. So I want to get out of that screen. So I close it, and then it pops up my other imaging modalities here. Okay. The next thing, we'll just go through our pictures here. Anterior capture is just going to be a regular white light. It can be a little bit bright, so it's generally nice to warn the patient, but you can see it's the same, about the same width. The same principle with the yellow rectangle. Okay, you can zoom in, you can find a feature to focus on, you can focus on a blood vessel, you can focus on an iris script, anything that you want to. Okay, and then you capture an image. You can do the same testing. You can sit back for a second if you want. Same as before, okay? You can do your anterior meniscus height, pupil function, or I'm sorry, not pupil function, pupil diameter, but you can also just measure any feature. You could just measure, if I just want to measure this freckle here, I can just measure with the ruler and find that it's about, 0.6 millimeters in width. Okay, you can measure the iris, okay, and find that it's about 11.75, probably somewhere in that range, 11.7. Okay, so anyways, there's a number of other measurement tools. We're going to just get that left one real quick and just look straight ahead. Okay. Zoom in if you want to. Sometimes you don't have to. Okay. Now, I'll have you just look down at the table. We'll look at the lids and lashes. Everything looks nice and clean. If there's anything to take a picture of, you can take a picture. You can take a picture while magnified as well if there's a particular lash that you want to zoom in on, but when you take the picture in the zoomed in focus, the picture will come out zoomed in. Okay, and let's do the same thing here. Everything looks very nice there. So we're just going to save those images, and then when it's done saving, I'll close that out. I do want to go back to the Meibomian gland image because oddly, that's the thing we forgot to take a picture of. So we're going to go back over here and we're going to get those pictures of the Meibomian gland. So it's always best to start with the instrument as far back as possible. With the photography, you're going to be pretty far away from the patient, and with topography, you're going to be really close to the eye. So just keep that in mind. With the photos, you're going to be basically almost as far back as the instrument will go. You have the patient look up. I've got clean hands because I use the hypochlorous acid spray, but you can also just use like a Q-tip, whatever you want to do. And you look up, and then you can use a Q-tip or your fingers, and then you just kind of roll the eyelid. Use your rectangle. You can focus, although it's a little harder to see in infrared to focus like that. And then ultimately, when you think you're in pretty good position and you can minimize some of the reflection from the camera, then you can hit capture. And you can do the same thing on the top ones. I'm going to just do that for you real quick. Look down. And just keep looking down. Okay, and then again, you'll see the superior Meibomian glands look a bit different. They're long and skinny. You can capture those. Look up. Good, good, good. And then coming back over here, I'm going to have you look up. And then looking down. And then you can sit back if you want. And again, same as before, you can zoom in and you can evaluate any of these glands here. So we'll go ahead and just save everything at once. Okay. If you want to see a particular image with more definition, there's something called enhanced Meibomian glands. You can use enhanced Meibomian glands, and then you'll see that there's two options here. There's the enhanced version, and then there's the original version. Enhanced and original. If you like the enhanced better, then you can go to Edit, set this to have a default where it's on the enhanced, and that will save it as that. Okay, and we'll go ahead and just do a regular topography scan. This is placido disc topography. Placido disc topography means that it projects placido rings onto the eye. Okay, takes over 100,000 data points off the cornea. You'll see as we get closer and closer and closer, those rings will start to appear. Okay. Ultimately, what you're trying to do is you're trying to get the green kind of cross in front of the central ring is green. Try to get the green cross in from that ring, and then once the red bar touches it, it'll automatically capture. Okay. If you're going to do what's called a axial alignment or a visual alignment, which is what she's in now, where she's basically using her visual axis. Okay, that's good from a visual performance analysis, but not as good from a corneal structure analysis. So you'll see that the rings are going to be more centered towards the nasal part of the cornea than the temporal part of the cornea because of the natural position of the eye and angle kappa. So you're going to basically blink a couple times, open your eye real wide, and then it'll basically just automatically capture that. When it automatically captures, you'll see a whole bunch of them over here. You basically can either select the greatest score, you can look at each individual map. Okay, 92 is a good score. Things look fine there. The rings are nice and even. The eyelashes are in the way a little bit, but for our purposes, this looks great. Okay, so we can select that image. Okay, we'll do another one. Only this one, what I want you to do is look maybe like one ring towards your nose. Okay, and so now that she's changed her fixation, she's not looking at the green dot anymore. She's now looking slightly inwards. You can see that we are pretty equidistant between the iris and the first rings. So now the cornea is facing straight at the camera. And this is what we call geometric alignment. Open nice and wide. Blink, blink, blink. And what I'm doing is I'm hitting the central capture button with my thumb if I want to manually capture something. If I don't want to wait for it to automatically capture, I can manually capture as well. This was the first one. I can look at axial curvature, tangential curvature. I can just kind of look at it through my normal camera. And then this will be all my various data points. So as I zoom in, all these tiny little white dots are data points. If I see any particular areas that don't look right, I can delete them. So if you see over here to the right, if I don't think that looks real, I can just use this little eraser and I can just delete them, and you'll see the white dots turn black. Okay, if you zoom out, the further you zoom, the easier it is to delete large areas. Okay, and then that won't show up in your image processing. Okay. And then it gives me an option to remove the data points, and you'll see that they're gone now. You can select your favorite one. You can select all of them. For right now, we're just going to select everything. And we're going to hit finish. You can also label them. A lot of these maps, you'll see the red at the bottom, that's from the tear meniscus height. So these would not be great maps to use. They're just for demonstration purposes. So moving along, other options here, we're going to go to tear film analysis. Tear film analysis, and again, video topography are essentially the same thing, just with a little different software analysis of the data that's capturing, but it's going to just be a video recording from the Placido disc rings. Okay, so it's just like your normal topography. They'll see a central kind of green target. Okay, and then what you have to do once you're pretty close, if anything's bumping into forehead or nose, I always just tell patients just to essentially move themselves. If they feel their brow bone kind of getting bumped with the instrument, then just move the brow bone out of the way. If they feel their nose is getting a little bit bumped, then ask them just to move their nose slightly out of the way. Okay. And what you're gonna do on this one, you're gonna blink a few times. Blink, blink, blink. Full blinks. There we go. So after 2 big full blinks, the video will record, and then you just tell the patient just to keep their eyes open, basically as long as they can. Okay. Your eyes are pretty dry. Yeah. So this is what it gives you. It's going to give you a colorful map. You can turn the color off ultimately. You can play the video, and you'll see the ring started out nice and smooth. But after just a couple seconds, you'll see that there's some distortion and broken lines. Okay, that's what we call ring jam. Okay, I'll play it again. Initially, the rings are pretty smooth, but after a few seconds, you'll start to see these scattered, broken, damaged lines. Okay, that's going to get translated to a colorful map, where when the rings are smooth, it's blue, and as it gets more and more drier and drier, it's going to turn warmer in color. Okay. When you come over here, The instrument's going to automatically assess how long it took for the tear film to evaporate. It's saying 2.7 seconds. The green dots are essentially talking about how much of the cornea was covered in blue. Maybe not the entire cornea, but about 9 millimeters, okay? And in that central 9 millimeters, we were pretty good up until about 2.5 seconds, in which case you can see on the previous images, that's when the lines started to break apart. And then the further and further degradation, the warmer and warmer colors. And so that's basically, as these dots go higher and higher and higher, it's just drier and drier. Eventually, they'll have to blink, and when they blink, it just turns the recording off. You can set the duration to 15 seconds, 12 seconds, 10 seconds, 20 seconds. You can control that yourself if you want. It's automatically going to initially be set for 15 seconds. So if they don't blink by that time, it'll automatically shut off the recording, because that's very adequate tear film. Okay. And then you basically just hit next. You can make any notations if you want. You can label it if you want. That's all that we'll kind of go through right now with the Medmont Meridia. We come back and look at software analysis later.